هذا الفيديو مقدم لكم من Global Men's Wellness، خبير الصحة الذكية المتوفر على مدار الساعة طوال أيام الأسبوع. لا توجد رسوم مشاركة ولا غرف انتظار ولا محادثات محرجة، فقط إجابات حقيقية متى احتجت إليها. قم بزيارة globalmenswellness.com لتجربته مجانا، واحصل على خبير صحة شخصي عند الطلب اليوم. Welcome to the Global Men's Wellness Podcast. In this episode, we're going to focus on the single most important tool for protecting your sexual health, the conversation you have with your doctor. For many of us, this is the most awkward part of any checkup. We might be embarrassed, or maybe we just don't think it's relevant if we don't have any symptoms. But what if I told you that a structured, respectful conversation could be the key to preventing serious long-term health consequences? Today we're going to explore a simple but powerful framework that every patient and every doctor should know. The 5 Ps, a method recommended by the CDC in its 2021 STI treatment guidelines for taking an accurate and effective sexual history. So, what are the 5 Ps? It's a straightforward approach designed to guide the sexual health discussion to ensure all the critical areas of risk are covered. It's not a rigid script, but a way to organize the conversation in a compassionate, non-judgmental manner. The 5 topics are partners, practices, protection from STIs, past history of STIs, and pregnancy intention. This isn't about prying, it's about prevention. An accurate risk assessment is the very first of the 5 major strategies the CDC outlines for controlling STIs, and this is the tool that makes it happen. Let's break down each P to understand why it's so important. The first P is for partners. The conversation might start with simple, open-ended questions like, are you currently having sex of any kind? And, in recent months, how many partners have you had? Then, a crucial follow-up, what is the gender of your partners? This isn't about labeling your identity. It's about understanding your potential exposures from a purely biological standpoint. Knowing the gender of your partners helps your doctor assess your risk for specific infections and understand the types of tests you might need. For example, men who have sex with men, or MSM, have different screening recommendations than men who only have sex with women, and this first question opens the door to that. The second, and perhaps most crucial P, is for practices. This is where the conversation gets more specific, and it's where a lot of vital information can be missed if the right questions aren't asked. Your doctor might say something like, to understand your risk for STIs, I need to ask about the kind of sex you have. Then, they'll ask about vaginal, anal, and oral sex. Why is this so critical? Because different sexual practices transmit different infections to different parts of the body. For years, STI testing for men was often just a urine sample to check the urethra. But we now know that gonorrhea and chlamydia commonly infect the pharynx, the throat, and the rectum, often without causing any symptoms. For a man who has receptive oral or anal sex, urogenital-only testing could miss up to 70% of his infections. Getting the right test for the right body parts is entirely dependent on an honest discussion about your sexual practices. The third P is for protection from STIs. This part of the conversation focuses on your strategies for risk reduction. Your doctor will likely ask about condom use, but instead of a simple yes or no, they might use normalizing language, like, some of my patients have difficulty using a condom with every sex act. How is it for you? This opens the door for a real conversation about barriers and allows for effective counseling on correct and consistent use. We know from countless studies that when used properly, condoms are highly effective at preventing the transmission of HIV, chlamydia, gonorrhea, and other infections. This part of the discussion is also a great time to talk about other powerful prevention tools like vaccines for HPV and hepatitis B and pre-exposure prophylaxis, or PrEP, for HIV prevention. The fourth P stands for past history of STIs. Your provider should ask if you've ever been tested for STIs or HIV, and if you've ever been diagnosed with one in the past. This is medically very important because having a previous STI is one of the strongest predictors for acquiring another one in the future. It's a biological marker of risk. A history of syphilis or rectal gonorrhea, for example, is associated with a significantly higher risk of acquiring HIV. Knowing your past history helps your doctor recommend the right frequency of testing for you going forward. For example, for some sexually active men who have sex with men with ongoing risk factors, the CDC now recommends screening every 3 to 6 months, not just annually. Finally, the fifth P is for pregnancy intention. For patients who could become pregnant or get a partner pregnant, questions like, "Do you think you would like to have children in the future?" are vital. This opens the door to important discussions about contraception, family planning, and the availability of emergency contraception. It connects sexual health to reproductive health, ensuring a truly comprehensive approach to your care. So, why is this simple framework so revolutionary? Because it addresses the biggest barrier to good sexual health care: communication. Many patients avoid care due to stigma, and many providers are pressed for time or feel uncomfortable asking these specific questions. The 5 Ps create a confidential, structured, and health-focused space to have this essential conversation. The answers you provide allow your doctor to move from generic advice to truly personalized care. It's the difference between just getting a standard urine test versus getting the comprehensive 3-site screening you might actually need. It's the difference between a simple "use condoms" message and getting a referral for HIV PrEP because your history indicates you're at substantial risk. This framework is the foundation of modern STI prevention. It leads to the early identification of asymptomatic infections, which is critical for stopping chains of transmission. It facilitates effective counseling, treatment, and follow-up, and it helps ensure that sex partners are also notified and treated, which is essential to prevent your own reinfection. The future of men's health is about integrating all aspects of well-being, and sexual health is a vital part of that. It is not separate from your cardiovascular health, your mental health, or your overall health. I do this work because I've seen how a simple, 5-part conversation can prevent devastating consequences down the line. From infertility caused by untreated chlamydia to preventable cancers caused by HPV. Breaking down the stigma around this conversation is the first and most powerful step we can take. So, if your provider doesn't bring it up at your next visit, you can. You have the power to guide the conversation and ensure you get the personalized, comprehensive care you deserve. تحكم في صحتك في أي وقت ومن أي مكان. قم بزيارة globalmenswellness.com وابدأ تجربتك المجانية اليوم. احصل على إجابات الخبراء بثوان، ليس بأسابيع، دون تكلفة أو انتظار أو محادثات محرجة. دعم حقيقي بشروطك. قم بزيارة globalmenswellness.com الآن.